Okay? So let's switch gears now and talk about SHA. And I'll start with you again, Victor. What has your experience been like? Is it working now or not?
Okay, thank you, Trevor. But allow me 1 second before I come to SHA, but I'm coming to SHA. Let us also leave education, politics out of education. We have had a critical discussion over the past 2 weeks in the country, whereby we've had politicians trying to politicize education and placement of students to various schools. I am a beneficiary of a national school. Myself, I was in Murang'a High School. Coming from Eldoret, I went to Murang'a High School, studied for 4 years, and I got an opportunity. I am where I am today as the CEO of Zero Barefoot, courtesy of education, quality education that I got from a national school. Also, let's not politicize placement of schools. We've had the former deputy president, I call him the former impeachee, saying that the community, the local communities, formerly Mount Kenya, is not having an opportunity to place students in their national schools. Also, we need to leave politics out of school. We've had other politicians going to launch projects when the normal school learning activities are continuing. You find a member of parliament walking to school at 11:30 when a maths lesson is going on and trying to launch a project forcing students to get out of class and perhaps affecting learning processes. We need to leave education and politics, separate politics and education. Coming now to your question about SHA, and also to my friend Linus, saying that the president is making a roadside declaration and running budget using his own mouth. I think you need to stick to economics and leave politics and leadership aside, because really, what do you mean when you say president is running a budget in roadside declaration, when you find that president as a leader and the head of state is making a statement and a declaration to ensure that all kids transition to grade 10, and then you say it's a roadside declaration, and then you come to the panel and say, as the leadership, the president is not working, we need free education. And then when the president say 100% transition, you say it's a roadside declaration. When the president is not saying anything, you say the president is working. Also, we need to, as a nation, I think we overdo politics, and William Ruto, the president, His Excellency, has gone through a lot of criticism, and I don't understand why. You know, president also is not the brother to Jesus Christ, and he's not an angel, he's a human being. And he has his own weaknesses as the head of state, and he can make political statements, but he's the head of state. He has a mandate, he has a duty to protect and to be able to govern this country in his best way possible. Let's come back to SHA. Coming back to SHA. Yeah. Over the past few years, we had a transition from NHIF to SHA. And we've had success stories, great success stories, and we have had failures. The issue now is it really working? How is the transition? I've had stories about people talking about SHA is not working. When you walk to an hospital, it is not able to cover outpatient. It is only covering inpatient. But when I was here, I think 3 months ago, I shared a story about my grandmother. When we were going to admit my grandmother in MTRH, Moi Teaching and Referral Hospital, we actually applied SHA on our way to the hospital. And on reaching the hospital, we were able to admit my grandmother, and we were able to use SHA immediately after applying. So we have had a success story whereby we were able to be covered by SHA. And these are some of the success stories. And we've had a lot of Kenyans saying that they have been able to be held by SHA. And a lot of success stories are there. But again, there is an issue which we must address as a nation and as a country. We've had failures whereby there is a lot of system issues, whereby when you go to a hospital, for example, in my local hospital in Ziwa district, and then you are required, you are now told that for you to be able to access, you need to pay a premium. You need cash for some services. You are told you need to buy medicine directly. You need to pay for consultancy fee. So entirely SHA has got challenges. And these are the critical challenges that now the leadership, the members of parliament, the senators, and also the head of state need to address. There are a lot of caps that are now existing in SHA. When the program was rolled out, it was running efficiently. But along the way, we've had a lot of administrative challenges and the disbursement of SHA money to hospitals. We've had a lot of complaints from hospitals saying that they were not able to receive their allocation and they cannot be able to process SHA payments because of the bending bills, which are supposed to be allocated to hospitals. So these are some of the challenges. These are real challenges outside politics that we now need to address. Let us not bury our heads in the sands and address these challenges because our people are suffering. Yes, I may be supporting government, but the challenges that I go through on health is the same challenges in Katonsweni, where my brother is coming from, or Kitui, or Machakos, for example, or my brother from Western Kenya. So these are critical challenges that as the young people, and I actually challenge the young people that it is time that also we jump into the ring and go for this leadership position as we near 2027, so that we can be able to be the change also that we wish from our leaders. We can be the change that we wish from others, because we've had a lot of challenges. And where is our position as the young people? Apart from airing our grievances and our voices, we also need to take up leadership role, so that these are some of the critical challenges that we see today. We can be able to be the solution bearers of these challenges that we are today. Because I think the current also members of the president actually is overworking. I have had issues where I even pity the president. He is really overworking and micromanaging a lot of ministries, because I think at some point, some people were given opportunity to serve in different leadership capacities are not able to deliver, and leaving the head of state the huge burden to deliver on behalf of work which are supposed to be done by them. So I think we have had success stories, and I am a beneficiary of SHA, and it is working to some extent, and there is a 20% which will be now fine-tuned so that we can have a smooth running.
All right, let me hear what Osapiri has to say. What has the experience been like? In this show, for young people, what I tend to do is just let them air out what the issue is and give recommendations, how they think it can be fixed. So how has the experience been like for SHA? Is it working?
Thank you, Trevor. Maybe just in a second before I transit into this, let me say this. That let me say this because education and health, these are critical issues in this country. So we have mentioned about funds being distributed in schools in various institutions, but we are forgetting that those funds that are distributed in those schools need to be audited. At least each and every time, this money that is sent to these schools, let them be audited. There are some senior heads of school institutions. You find somebody heads an institution for 2-3 years. The next year you find he wants to be governor, he wants to be senator, he wants to be MP. Where does a school principal get these funds to provide for a governor seat? This is because some of these heads of institutions are thriving into the funds meant for the students, for the pupils, then use them as campaigning materials. They fund their campaign using the funds meant for the young people in schools. So we want to request the government that once you wire the funds into these institutions, please make a thorough follow-up, and those who will be found guilty, let them be reprimanded. Because we should not be having corrupt cases each and every time in this country, and we leave them scot-free. Any head of institution who is found guilty, let him be taken behind bars. Another thing, the issue of having ghost students. It's a critical issue because it is being brought in by corruption. Some heads of institutions sit somewhere, come up with the figures that are nowhere to be found. When you go to a school, you find a school has got an enrollment of 400 students. But on the paper that has been sent to the ministry, because they want money, you find they're indicating that they have 1,200 students in a school. So before the school, before the Ministry of Education wires money to these institutions, let them also do a follow-up. Let them do a thorough follow-up in this institution to ensure that you have brought 500 students. Is it true that there are 500 students or there are more than 500 students? So when I come back to SHA, Trevor, I tend to believe that anything concerning health is a very critical issue to each and every one of us in this country, and we all deserve treatment. We all deserve equal treatment as a nation. Transiting from SHA, from the previous reform to this other reform, we tend to believe that in between we've had challenges. As a person, I have an issue when you tell me that you can only be treated when you are you are here for some days in this hospital. SHA will cover part of your medication. But let us talk of a case whereby I was transiting maybe from Bungoma headed to Nairobi. Then by bad luck I got an accident, but I was actually just had a minor injury that I have been paying for SHA. I am employed somewhere, I'm paying for SHA. Instead of the hospital taking care of my medical bills, I'm told, you know, this one you have to pay because you are an outpatient. When you are paying, there's no particular point where you've been told this money is only meant for inpatient. When the government wires these funds to these hospitals, it doesn't indicate that this is for inpatient. Therefore, we want to ask those heads of these hospitals that once the government has wired money, once Kenyans, the taxpayers have given out these funds, please let the heads of institutions and the heads of hospitals ensure that every Kenyan, be it a poor Kenyan, a rich Kenyan, let them be treated equal. Let us not have issues whereby somebody is being treated based on how he contributes. The president said clearly that he's going to pay for a number of people in this country. And Trevor, sincerely speaking, poverty is on a very high rate in this country. It is going, if the government does not take measures to ensure that we have proper ways of curbing this issue of SHA, it is still disturbing Kenyans. Okay. So we request that at least let the government make clear, let the government make things clear that SHA is free for all Kenyans, be it outpatient, be it inpatient. Okay. Let us not be saying, let us treat those who are inpatient and outpatient. No, because that outpatient person is a person who has no money, somebody who cannot even have transport from his home to that hospital, to that dispensary to get the treatment. So I find, as I finish on that, Trevor, allow me to say this, that politics has also been entrenched into this issue of, in the issue of health, because you find that when the head of state is making appointments, instead of picking on qualified people with the masters, people with PhDs in medical fields, you find a politician who contested for maybe a women rep seat and lost, a member of parliament who lost an election is being given an opportunity to head the Ministry of Health when this person, maybe took studies as a librarian. This person maybe was a retired KDF, surely. Let the government make right appointments for the people, for the leadership into these institutions, so that we curb this issue of corruption, so that we curb this issue of people heading institutions that they don't understand what it should be done. Okay. Thank you.
Peter.
Thanks again. So also let me finish up on education. Also, the last issue with this issue of education, which I believe is also an elephant in that room, is corruption. There's also the issue of ghost students and also ghost schools. And as I started, I also said that it's also a problem of leadership and also the regime as a whole. Because I'm sure the ministry is also aware of these ghost schools, also these ghost students in these schools, but they do nothing about it. And when you look at our independent anti-corruption agencies, they do not pursue such cases. They are used for political witch hunt. Currently, they are looking into the issue of my governor, which is, of course, politically motivated. Instead of going to schools and looking at also doing a full audit of some of these students in schools, looking into which cases are also very legitimate and which ones are fake. You go to you narrow down to also institutions like primary schools. You go and find, like, there's another one I saw in I don't know if it's in Gishu, a ghost school that has been there, only a gate that is there, but there's no school inside, but has been receiving capitations throughout. So they should also address this issue of corruption and also narrow down, instead of also using their energy for political witch hunt. So on SHA, let me start by saying that we were in NHIF, then we transitioned to SHA. The first question is, was there a problem with NHIF really? For us to invest 104 billion, which also the Auditor General said that despite us paying 104 billion, we do not own the whole system. It is not owned by the government. So who will be accountable and who will follow up? And hence, SHA has been having problems throughout. Because number one, let me give you a real case scenario. If you go to a hospital today, you go and submit your insurance details. SHA will authorize. Yes, SHA will authorize. And I've also seen the president say, ukienda hospitali, SHA itafanya kazi. Yes, it has authorized. But will it pay the providers? Will it pay the hospital? No, they do not pay. And I saw the CS for Health, Aden Duale, was on Citizen TV just some days back, was being asked the same question. And he was really having a hard time answering that question because most of these hospitals, despite authorizing payment, they are not paid. Hence, they do not, today, if you go to most of these hospitals, they do not take SHA. Why? Because they are not being paid by the government. They do not receive their payments. Number two, I've even seen on today's paper that there's also the delay in authorization. Today, if you look at today's Daily Nation, you'll see that there's a case of a surgery, most surgeries. SHA is not authorizing on time. And if you do not authorize on time, what does that mean? Number one, the patient might lose his or her life. Number two, the patient becomes worse. What does that lead to? It means that SHA is not actually really helping. And as I said in the beginning, the whole problem is because of a failed system. The whole SHA system is a hoax. I believe it's a hoax. It's not working. If it's authorizing, it's not paying the hospitals. And I saw the PS for health, PS Olunga. He said that no hospital should turn you away because, or should not turn you away, or should request you to pay in cash. But also, let me ask, these hospitals have got workers, they have got nurses. These nurses need to be paid. These doctors need to be paid. These hospitals need to be equipped, need to be set up running with equipment. Who will pay for this if the government is not paying for these services? So the problem itself is in how the government is rolling out SHA itself. Another problem with SHA is that we have got around 18 members who have registered for SHA. But how many people are paying? Only 4 million people are actively paying. So where will SHA get this money to pay if the government itself is not able to capture all the people who, not able to accommodate more people into the SHA system? I think the government genuinely needs to go out and ensure that people are actively paying, using maybe means like encouraging people to register for SHA using as little money as they can, because not everyone can afford to pay for SHA. Right. It's only a few people with pay slips that are able to pay for SHA, but it's not everyone. Right. And that translates to the problem of not even the government not even being able to pay for services in hospitals because they're not receiving the monies from the contributors themselves.
Let me hear what Sifuma has to say. Sifuma, what has been your experience like? And I know you deal with the people firsthand, so they also come to you.
Trevor, I think, let me just also, on the president said, I think my colleague here was speaking from both sides of the mouth, and that's what majority of Kenyans do. And at one end, he's saying SHA is not working. And he's saying, we encourage all people to actually join SHA. What are you really saying? I'll come back to that. And, there's another comment that was made at the president is running the budget out of his mouth. And you've just been from commenting about education. And we have for the first time a PhD, a doctor, who's a president. And that is meritocracy at the highest level, because he understands what needs to be done. So I think sometimes he picks figures out of the top of his mind, and people think he just comes up with these figures. Actually, if you can go and counter check most of these figures, they're actually real figures. So in one end, we cannot condemn and say the president is picking out things out of his mind, yet we are saying we need meritocracy in leadership. We can't speak from both ends of our mouth. And again, another one is when he mentioned that the government is focusing on going after a governor instead of actually looking at rogue schools and, ghost schools and all this. We will multitask. We will go after rogue governors. We will go after rogue hospitals and institutions. And everyone has to be accountable of what they are doing. And even in my county, I will refer back again. In our county, we are putting Governor Tim Onyonyi as the next governor of Bungoma because we have seen what he's doing in Westlands, and we want him to do that in Bungoma because we have seen our gaps in Bungoma. That said, let me come to SHA. SHA is working, Trevor. SHA is working. It has worked for me. It has worked for my grandmother. It has worked for my sibling. I would say SHA is working. SHA to work is not about how big of grammar we are going to line up on this show this morning. It's if a Kenyan falls sick, are they going to access healthcare? Period. A Kenyan does not want to know who is the CEO of SHA. They don't want to know which policy is guiding which particular disbursement. They don't want to know if money is being paid to the institution. A Kenyan wants to know, when I get sick, I have SHA, I go to hospital, I'll be treated and I'll be okay. That's what a Kenyan wants to hear. And for most of, just like any other change process, there's normally teething problems. And we had that a lot with SHA. And even as you look at the numbers, and I like to refer back to numbers, because the uptake was very low when SHA was actually rolled out. First of all, there was a lot of misinformation, miscommunication. People didn't understand what is really happening. But over time, we've actually seen clearer communication from the ministry. We've actually seen a higher uptake of people actually subscribing to SHA. And even those who critique it, you can actually find majority of their family members and their community members, they're actually on SHA, and they're actually leading in terms of numbers. So for me, I'd say SHA is working. Does it have challenges? Yes, it does. Because again, we are coming from a place where there were ghost institutions that are actually receiving this money. There are actually some of, I think more than 1,000 hospitals or clinics have been actually closed because they were swindling this money. And as SHA goes on from one stage to the other, we will see, I think personally I've seen transition. There's a time there was a challenge or the amount of money that was given to cancer patients. There was a revision of it upwards from what NHIF used to give. So I think for any particular project, just as SHA is one of it, we need to critique it positively. Yeah, because any critique that you give to government policy or projects will actually help that policy to improve. Because I actually want to agree and say, there was a time clergymen came out very strongly condemning SHA, and their points were actually valid, most of it, because they were saying there was delay in paying the institution. Was that corrected? Maybe yes, because I actually saw another time they came out again saying, now we understand how it's working. And they actually accepted that, no, we didn't understand how this animal was working. And change for any people is a very hard process. There's a lot of teething, there's a lot of, fighting back, there's a lot of growth that needs to happen. And we actually have to give that leeway to SHA. SHA is only like, let's say, 2 years old, and we want it to be here for posterity. How do we make it better as Kenyans? Can we critique it positively? When you go to an institution or a hospital, when a finance person wants to play jokes with SHA, and you're there, you're watching. Maybe they're saying you've been treated for, maybe you've been admitted, and you just maybe went for a tooth extraction, just for example, or a headache, or for a very simple procedure, and they're going to charge you for a very complicated procedure. Will you just stand there as a Kenyan and just say it's okay? Because you see, we are also supposed to actually protect this SHA for it to work for us. Because if we allow for SHA, like most insurance covers, I think most of you can attest to this. Most insurance covers, once they see the cover that you have or the amount of outpatient cover you have, they'll just charge you some obnoxious amount of money. But if you go to pay cash, it is actually a different charge. So we should actually, as Kenyans, be the watchdogs again. Any institution that is actually doing any scrupulous things, they should actually be brought to book and to be told, these ones, they need to be investigated. There's something they're doing that is actually wrong. Okay. And just to refer it a bit, just for a minute, to education, most of MPs or leaders might not want bursary scrapped off because there's a lot of monkey business happening with school bursars and actually MPs. There's a whole cartel that needs to be actually disbanded. And I know it will bring a lot of heat, but there's actually a lot of games that are happening with this bursary. A leader, I know of a leader who takes, let's say, if he gives 10,000 to a school, he will go back for 7,000 in the evening. So only 3,000 is what will remain in that school for bursary. So it's a cash cow. It's just a big animal that many unscrupulous leaders are actually using at the peril of citizens. All
right, Linus, how's the experience been with SHA?
Trevor, from personal experience, I haven't experienced SHA, but let me just make a few comments in regards to what my fellow panelists have said. Kiprono used the words micromanaging ministries in reference to the president. So even as he was criticizing me and telling me to stay away from politics, which I really want to stay away from, because as a consultant to politicians from both sides of the divide, I would not want to be one term or two term. But what I want to say is that we have had exactly what he has described, that the president we have for the first time really had a president who is really everywhere and everything about everything. The ministers in President Ruto's government are not taking responsibility for what they're supposed to do. The PSS are just leaving it to him. So he's the one who, again, is out there articulating the government policies. However, if something is working, and I'm going to tie this to a little bit in education, even as I touch on SHA. In this country, if from a policy perspective, we have a problem of conceptualization of policy and implementation of policy at the same time. But if something is working, and I'll give a very good example of something that is working in President Ruto's government, that is the Higher Education Fund. The way it was conceptualized such that we need to have scholarship, and then there's a loan, and then there's also what the parent is paying. And if you look out also at the way the portal was created in a manner that once you feed your details, it would then be able to tell you exactly how much you're supposed to pay, while it was well conceptualized. And in fact, during the implementation, while people never understood it, it was a pretty straightforward thing that once you went to the education, the HEF portal, and you did it, you were able to see actually what fee you are supposed to pay, and you just went to the university and paid it, and that's it. So what I was trying to say here is this. When something is working from a policy perspective, then you don't need to do a lot of rallies to explain it. When was the last time President Ruto stood on a platform to defend Higher Education Fund? We don't remember, because it's working. So when it comes to SHA, and almost everything that I needed to say, my brother has already said, that as a country, again, when it comes to conceptualization of policies, we then tend to also forget we forget quickly where we are coming from. Why were people really thinking that we needed to replace NHIF? The very problem that we are facing today. When you look at the time NHIF was being disbanded, the liability side of the entire thing was only 27 billion. That was the liability side. So it means that hospitals were already beginning to decline offering services to NHIF patients because they felt that it was not being paid. The government were owing institutions up to the tune of 27 billion. But here's a government that comes in, instead of sorting that problem out, they end up doing what? Using another 104 billion to replace that system, quote unquote, and actually it's only the technological side of it that was replaced, and further sign a contract that allows it to pay the providers 10 billion every year. Okay? We are paying the same providers 10 billion every year. So then the question is, does SHA really solve the problem that we have? As a country, we need to rethink our healthcare system into only very simple parameters. We need access to healthcare, we need affordable healthcare, and then we need quality healthcare. Okay. Only three things.
All right.
And so, Trevor, if we're looking at it if we're asking ourselves the question as to whether SHA is working or not, then we need to really ask ourselves, when people go to the hospital, are they able to get the doctors there? Are they able to get medicine over that place? Do they even have access to that particular hospital in the first place? How affordable is SHA to the people? And then, in terms of expanding the entire healthcare system from curative to preventive, does SHA help us with these kinds of things? For me, my submission is that the answer is no. And as a country, we really need to rethink around how we are doing our whole healthcare system to achieve the very objectives.
All right, ladies and gentlemen, we've run out of time. Let me bring up some quick feedback and close on this conversation. And thank you so much for speaking to us this morning. Let's see what you're saying now. Bobo Wino says, SHA is not working. Despite my cover being active, I was slapped with a huge maternity bill. The frustrations from staff are constant. Mara system imehang, hakuna internet, inakava pesa kidogo, hiyo ingine lipa. It's just a lot of things going on. Okay. Michael Simiu says, from this January until slightly past general elections next year, almost everything, education, SHA will work in favor of the common mwananchi to win the innocent vote. I know as a country we can do better if we think beyond politics. All right. Simon says, good morning, Trevor. Kenya SHA isn't working. I'm a teacher, and we were recently moved from Aon Minet to the SHA comprehensive cover. While in hospital, I was told that SHA could only cover my consultation fee. I had to pay for drugs and tests out of pocket. SHA isn't working. All right.
Trevor,
that's where we leave it for now. Thank you so
Trevor,
much for making time. We've run out.
Just to answer her.
We've really run out.
Just to answer
Peter,
her.
thank you so much for making time.
You will answer offline.
Maybe offline.
Online. Thank you.
I will also answer you
Coming up
Just
like
a
Level Up
shot.
Friday. Thank you so much for making time. Bye for now.